Hello, and welcome to a presentation about toilet training written by Leanna Gonzalez, Board Certified Behavior Analyst for Cleveland Lifelong Learners. Just a disclaimer before we start, this presentation is on evidence-based practice with toilet training. There is no one fit for parents, and this video is not meant to pass judgment on different toilet training methods. We're just presenting the current research and giving you all of the information that we have. Why should we get started on toilet training? What are the disadvantages of waiting to toilet train? Oftentimes, skin irritations may develop. Wearing diapers can cause your child to develop soreness, redness, or diaper rash. These skin irritations can even be painful for the child. Secondly, having a child in diapers is a large time commitment. You're spending a lot of your day checking and changing your child's diaper, and it all adds up. For example, the average parent spends 9 hours a week changing diapers for a 2-year-old, and all those diapers can be really costly. Lastly, sometimes the parent-child relationship is affected. It's possible for the nature of the parent-child relationship to suffer. This can happen because maybe people inaccurately presume that the parents are bad at parenting if their child is not toilet trained. And a child who isn't toilet trained may become over-dependent on the parent. These two factors can cause the parent to grow annoyed with their child. It's important to note that not all parents feel this way. If a parent does feel this way, it by no means makes them a bad parent. Parenting is hard. So we understand that potty training is an important milestone in our child's life. However, it can be difficult and daunting to many parents. During this presentation, we are going to give you some tips to making potty training easier for you parents and more fun for kids. It's important to know if your child is ready to be potty trained. There are 4 target areas to look to when determining if your child is ready to be potty trained. The first is age. The average age of kids ready to be potty trained is around 2 or 3. The second is bladder control. Does your child stay dry for several hours? Does your child indicate that they know when they're about to urinate? Do they do a pee-pee dance, or can you read their facial expression? Does your child urinate a large amount at one time as opposed to dribbling throughout the day? The third thing to look for is instructions. Is your child able to understand 2 to 3 step commands? Going to the bathroom in the toilet is a complex behavior, so it's really important that they can understand 2 or 3 step commands. And the fourth one is physical readiness. Can your child pick up objects easily? Can they walk from room to room on their own? It's important to note that every child reaches readiness at a different time. Now that you've determined that your child is ready to start potty training, let's go over some tips and tricks to potty training. Time. Pick a weekend that you can dedicate to potty training. You want this weekend to be as free as possible so you can give your child as much undivided attention as possible. Rewards. Have some of your child's favorite snacks and drinks ready. The snacks should be easily accessible. Provide them, with praise, to your child when your child's underwear are dry and when they sit on the potty or go to the bathroom in the potty. Be sure to pick snacks and drinks that your child really likes, and make sure you tell them why you're giving them the snack. For example, here's an Oreo because your underwear are dry. Good job! The drinks will be used as rewards too. Providing them with drinks also increases the probability that your child will need to urinate, giving them more opportunities to learn. Do not use milk or fruit juice. These drinks may upset stomachs if they are consumed in large quantities. During toilet training, your child should drink as much as they want. Offer them a drink every few minutes, but reserve the especially tasty ones for rewards. Underwear. Have your child wear underwear that are a few sizes too big. This will ensure that the child is able to pull up and down their underwear on their own. Also, the wearing of underwear and not a pull-up or diaper will ensure that if the child has an accident, it's uncomfortable. Having your child experience this feeling of discomfort is okay. It helps them learn. Potty seat. Be sure to have a potty seat that's small enough for your child. If you are getting a potty seat that attaches to the toilet, it's important that you have a stool in front of the toilet so your child is able to get on the potty themselves and so that their feet are not dangling. This will all promote independence in the long run. So here is how you're going to do the dry pant inspections. Check your child for dry pants every 5 minutes. Ask, are your pants dry? And have them feel their pants and tell you by saying dry or by using a head nod. If dry, show your delight. Provide a favored snack or drink and a lot of praise. You should prompt your child to sit on the potty every 15 minutes. The child should sit on the potty for 5 minutes total. Praise your child just for sitting there. It may seem like a small accomplishment, but it really isn't. As soon as your child starts to urinate, give a ton of praise. When your child goes to sit on the toilet or when your child urinates in the toilet, this is the routine they should follow. Do not place your child on the toilet. They need to complete the steps themselves. If they are struggling the first few times, you can help them with that. So first, you're going to walk to the potty chair. And then they're going to lower their pants, seat themselves, sit quietly for 5 to 10 minutes, stand up, pull up pants, remove the potty bowl, empty the potty bowl in the toilet, if that's the kind of potty bowl you have, flush the toilet, and then return the potty bowl to the chair. If you are not using a separate potty seat, there won't be a need for emptying the bowl. Just flush. And again, have your child sit on the potty every 15 minutes. They have to do this entire routine every 15 minutes. Once the child can do all of the steps of the potty sit routine independently, then you can move to a half an hour. The first few times your child sits on the toilet, have them sit for 10 minutes, then for 5 minutes. If your child walks the toilet themselves without prompting them, allow them to determine how long they want to sit there. Here are some tips and tricks. Don't be afraid to talk about poop and pee. You want to establish that it's a totally normal thing and that there's no shame around going to the bathroom. Expect the occasional messes and don't punish them. Don't make them clean up after themselves. Potty training can be really hard on kids. Be sure to have a step stool or a separate potty seat and make the bathroom fun and kid-friendly. When there is an accident, which there definitely will be, you can show disapproval. Love your child, but disapprove of the wetting. Don't be angry and don't punish. Require your child to do the potty routine that would have prevented the wetting. So make your child aware that he is wet and have them then initiate the whole potty routine to do some positive practice. Afterwards, have the child change into dry pants themselves. This is how they can take responsibility for the wetting. This is the end of our presentation today. I hope you learned a little bit and enjoyed it. If you have any feedback, make sure to let us know. And just a reminder, these are just some guidelines based on evidence-based practice. A lot of what you're going to do is feeding off what your child tells you that they're ready for. These are just some tips and tricks. Thank you. Have a great day.